Yep.
Okay.
A few more are jumping on, so I think we're good anytime.
Okay. I'm just trying to. Oh, my mouse isn't working like it should. There we go. All right. Well, any luck, this will work tonight. All right. What time do we have?
7:02.
All right, it's time to get started. Okay. Well, sorry everybody for my technology difficulties here. It's been a couple months since we've done Zoom, and we have tonight we're going to cover the thyroid. I like to do things in groupings, and I believe at this time of the year it's always nice to talk about energy. I was going to try to have this Zoom background picture with palm trees behind us because as we all know, we're in the short time of the year, and we all get cold in Indiana. So, but welcome to anybody that's not heard me speak. I'll have Kylie kind of go over the rules or how this all works. So I'm going to turn it over to you, Kylie. What's that? I froze?
Yeah, we froze.
Okay.
I think you froze.
Oh, me?
Yeah, you did, but you're back.
Okay. Well, I also have two Kylie Bakers here tonight. The more auburn colored hair lady, the darker colored is Paula, our nurse, not Kylie Baker. And then Kylie Baker is our operations manager, who's going to explain how we kind of run the program tonight. Go ahead, Kylie.
So we like to just save the questions for the end. And in the end, I will go ahead and open the floor up, and anybody is welcome to ask any questions that they may have in the chat at the bottom. Mine's at the bottom, yours may not be, but there's the chat or there's the question and answer box, and you can use either one of them. They will come to one of us and I will read them off, and then we'll answer them at the end.
Okay, great. Well, Paul is our nurse, so she may chime in some during the PowerPoint presentation. And of course, if there's a question that I don't always know the answer to, I will pass it on to Paula too. Paula does all the consults with our hormone consults, and she helps me a lot with thyroid. And so thyroid is kind of one of our centerpiece hormones that we work with day in and day out. I probably write half a dozen formulas a day on average, new thyroid formulations, as well as work with lots of doctors on making recommendations. So we have half a dozen doctors that send us labs quite frequently, and we'll explain all that as we go through. So I respect your time. I'm going to try to be done in about 45 to 50 minutes. I'll watch my clock. The thyroid is a very complex hormone, and I'll go through a little bit of some different things, but as I move through here, and hopefully my mouse will work. I do not know. There we go. I guess just a click of it. We are a compounding wellness pharmacy. We are PCAB ACHC accredited, which just means that people come in and actually look at how we do compounding and make sure we're doing it according to the standards. And we do medication management and nutrition consultation and natural hormone consultations. So, and then Paul is at head of my natural hormone consultations. Okay, guys, help me out here. There we go. We're locally owned and operated. We have served Michigan and Ohio for 15 years. We're licensed in Ohio also. And our mantra is no two patients are alike. So we like to customize the medications to the patient instead of the patient to the medication. Our mission statement is at our pharmacy, we co-create hope by taking the time to educate and empower. So tonight, we're educating. We're trying to give you information to make sure that whether you're getting a compounded hormone, or even if you're starting to tilt towards hypothyroidism, which we'll talk about, you'll know kind of some things that you can do to try to keep your thyroid as healthy as possible. And we empower you through empathetic listening and advocating for your best care. Here we go. Okay, so what's our objectives tonight? Well, we're going to talk about the thyroid gland, and we're going to discuss how it works. We're going to talk about the different hormones, which we'll call T4 and T3, and I'll describe in more detail later what they do. We're going to talk about the different types of thyroid diseases. We're going to talk about how to keep, what affects that thyroid gland, how do we keep it healthy, and what things will do, really will cause damage to the thyroid gland. We'll talk about the treatment of low thyroid, and we'll talk about hypothyroidism, and there's my first typo, it's subclinical hypothyroidism. And then we'll also talk about nutrition support for the thyroid gland. So let's start with what is the thyroid? Well, the thyroid is this gland that you'll see, it kind of looks like this butterfly, and it sits right over your trachea, right underneath your voice box. And it's a very small gland, actually. But that little tiny gland is so important. It does so many things for our body. And so people say, well, what does that little thyroid gland do? Well, come on, guys. It's involved with what we call metabolism. And what is metabolism? Metabolism is kind of your get up and go. It's what really keeps your engine running. And your body is this incredible 24/7 machine that constantly needs energy. And the thyroid is very involved with that. It's involved in fat burning. So when we see sometimes patients gain a large amount of weight when their thyroid is not working. So the reason is they're not utilizing their fat properly. So the body is in the storing mode instead of the burning mode. It's important for oxygen because thyroid actually helps get the oxygen into the cell where it's actually used to kind of put the power in the furnace. It involves things like your gastrointestinal function. So when you have low thyroid, you may be constipated. If you have high thyroid, you might have the opposite. You might have diarrhea. And it's important for how our muscles actually function, or how our nerves also function with our muscles. And so it's a communication device too. So when you have low thyroid, you are going to feel low energy. Now, if I take a step back, when I start talking about thyroid, I also have to start thinking about stress and blood sugar regulation. So you're going to see the next couple talks over the next couple months, we're going to talk about blood sugar regulation, and we're also going to talk about cortisol, because they are all three intimately involved in this thing called metabolism. And hopefully by the end of the night, you'll understand a little bit more about when I talk about metabolism. And as we age, our metabolism is going to naturally slow down, and there's several reasons for that. Part of it is the aging process itself. Part of it is we're being exposed to a more toxic environment over time, and that's affecting the health of our thyroid. Part of it might be the prescription medications we're taking. So there's a lot of different things, and we'll touch on many of them briefly tonight, that can affect the health of our thyroid gland. Well, that's going to drive me nuts tonight. The only thing slower than the internet at work is my metabolism. And we understand that because we have a slow internet sometimes, and it makes you nuts when you're waiting for things to move through. And so we all remember when we had dial-up internet. I remember I couldn't talk on the telephone with my dial-up at the same time. Now, of course, we have high-speed internet. And so, having that metabolism running makes all the difference in how you feel. Okay. So there are two types of thyroid disease that are common. One is called hypothyroid, and that basically accounts for about 95% of the thyroid disease. The other one is called hyperthyroidism. And if you really look at these two charts of the symptoms, you'll see that they pretty much are opposites. So for example, you can have weight gain and hypothyroidism. You can have weight loss and hyperthyroidism. You can have cold intolerance and hypothyroidism, and heat intolerance and hyperthyroidism. They both can give you fatigue, so there are some things that you will get. I used to know somebody who loved having her thyroid gland really revved up all the time because she could get her house cleaned really well. She didn't feel tired when she came home from work, okay? However, having too much thyroid is not good for you either, because it's kind of hard on your heart and your cardiovascular system. So, and it made her kind of a nervous Nelly, to be quite honest. So, you know, getting that thyroid balance is very, very important. So the problem with hypothyroidism is sometimes if you don't do the blood test to see what your hormone levels are, they kind of start, you know, I have depression and fatigue. Well, what could be causing that? Many different things. If I have high blood sugars, I can also have fatigue. If I'm extremely stressed and I'm not sleeping at night, I can have fatigue. So as you can see, sometimes some of these symptoms, whether you have thyroid disease or high blood sugars, or you're under chronic stress, you're going to see that many of these type of disorders go across all three of these types of issues. So it is important that we kind of know what we're doing. So I'm having to click my mouse 4 times to get it to go to the next slide. Sorry about that. So hyperthyroidism, hypothyroidism is basically hyperthyroidism when the body produces too much thyroid hormone, and hypothyroidism is when the body is unable to produce enough thyroid hormone. Or in hypothyroidism, also, maybe you're producing thyroid hormone, but your body's not utilizing it properly. So how does a thyroid function? Well, first of all, we have to understand that the thyroid is under the regulation of the brain. So there are 2 primary glands besides the brain. You have the pituitary gland and the thyroid gland. And depending on what gland is affected or what's going on at the receptor site kind of depends on what's going on. So the way I try to describe the thyroid, how it works, it's kind of like a heater or an air conditioner on a thermostat. So once your body wants to keep things at that right regulation. So think of your furnace at home. You set the temperature for 70 degrees. And there's some play in your thermos. It might go from 68 to 72. But once it either drops, you know, it gets too cold, like we are in Indiana right now, your furnace is going to kick on to kind of heat it up. So that's kind of what the pituitary gland and the thyroid gland do. So the pituitary gland is called the master gland. And the pituitary gland, as you'll see in the next couple of talks that we do, will stimulate not just the thyroid gland, but affects things like the pancreas, affects things like the adrenal glands. It affects things like ovaries and prostate tissue and the testes, and it affects everything in what we call the endocrine system. So everything that kind of comes through the pituitary gland is the endocrine system. Now, fortunately for us, the pituitary gland is under regulation from the brain, and TRH stands for thyrotropin releasing hormone. And what that does is when the pituitary gland needs a little help, it's starting to slow down, the brain kicks out this hormone called TRH. And the pituitary gland then senses what's going on with the thyroid gland. So the thyroid gland says, I need more T4 or more T3. And I'll explain that in just a second. So T4 and T3 are the 2 hormones the body uses at the cell, but they have to be made in the thyroid gland. And so when the T3 levels or the T4 levels start to drop, the thyroid gland says, hey, you know what? This person's up, moving around. They need a little bit of energy. So the pituitary gland sends a message down to the thyroid gland that says, get it kicking, guy. Let's get the T4 and the T3 made. And it does that by sending a hormone called TSH, thyroid stimulating hormone. Now, that is what we tend to measure a lot of times at the, what a physician will measure. And it's the amount of TSH that determines. So if the pituitary gland has to send a lot of TSH out, that's telling us that the thyroid gland's kind of a little bit lazy. Something's going on with the thyroid gland. Either it's not making enough T4 or T3 because it's been damaged, or that there is some kind of resistance going on. Now, what's interesting is T4 and T3 are under the regulation of certain enzymes. And I'm not going to go too deep into the enzymes, but I want to make sure everybody understands. Sometimes we measure TSH, but it's kind of like, you know, it's really the enzymes that we really need to pay attention. Now, the problem is we can't measure the enzymes very easily. So the enzymes help convert the T4 and the T3 into active components. And what happens is T4 is actually a weaker thyroid hormone than T3. T3 is the one that moves around and does most of the work. It's extremely potent, but it has a very short shelf life. In other words, it's used up immediately. We don't store it for a rainy day, and the T4 more or less does. So if you'll see down here at the bottom, you'll see the T3 then fits these thyroid receptors in the tissue cells, and it's these receptor cells that give us the effects or the symptoms that are going on. So for example, T3 isn't able to stimulate burning of oxygen, then you're going to start feeling fatigued or muscle cramping. Okay. If T3 is involved in growing hair and now you don't have enough T3, guess what happens? Your hair falls out. If T3 is involved with your heart, as you can see in the little things down below, if T3 is involved in the heart and it can't, then the heart slows down and you get what we call bradycardia. That's the slowing of the heart. Okay. So again, T4 is a weaker hormone, but it's longer acting. It lasts a lot longer in the body. T3 is a stronger, more potent hormone, but it's shorter acting. So the body has to convert the T4 to the T3 quite often. Okay, so what do? Well, we measure the thyroid. We like to measure 3 hormones primarily: TSH, free T4, and free T3. And so if we have an elevated TSH, that means we have a low thyroid, and we have if it's hypothyroidism, it's elevated. If it's decreased, we have hyperthyroidism. And the normal reference range is 0.3 to 3. And this is the ranges that the American Thyroid Association, ranges. Now, optimal might be different than 0.3 to 3. And we'll talk about that in a little bit. Free T4 is elevated in hyperthyroidism and decreased. And again, its range is 0.7 to 1.8. And free T3 is 0.2 to 0.5 nanograms per deciliter. So again, depending on, you'll see it's a little bit higher. Actually, most labs in our area are 0.2 to 4.4. So depending on whether you have what the measurement and these hormones are determines what goes on. Sometimes we see some mixed things, which makes it a little bit, so for example, we might see a decreased we might see a decreased TSH and a decreased T4 and a decreased T3. And that's when we have to start looking at some different things, because they don't really mix. Usually if the T4 is low and the T3 is low, the TSH is high, and vice versa. Okay. So I know that's kind of complicated, but that's why I give you this little chart here. Okay. Subclinical hypothyroidism is when the TSH is elevated, but the T4 and the T3 are in normal range. And this is probably one of the most controversial things to treat with thyroid right now. You get some doctors that want to treat it. You get other doctors that don't want to treat it. Regardless of whether you treat it with hormones or not, it's my opinion that we should at least try to look at what is causing that TSH to be elevated and try to do some lifestyle things that will kind of help bring that TSH back into effect, back into control, back into range. So let's talk a little bit more about hypothyroidism. Roughly 11 million Americans suffer from hypothyroidism. It is the single #1 endocrine disorder in the country. Okay. The drug Synthroid or levothyroxine is the #1 dosed medication in the world. Okay. So in other words, there are a lot of people taking hypothyroid disease. Hashimoto's disease is a form where it's an autoimmune disorder where the body actually attacks its thyroid, and you actually become allergic to your own thyroid hormone. And so it's quite interesting. It produces antibody against its own thyroid tissue. And so over time, what happens is we get this constantly inflamed state, and the thyroid gland starts to become attacked by its own body. And so we call that an autoimmune disorder. And so what's interesting is in the United States, that's the #1 form of hypothyroidism. However, worldwide, the #1 form of hypothyroidism is low iodine, not getting enough iodine in the diet. And we see that in a lot of third world countries where people are malnourished, they do not get iodine in their diet. We'll explain that reason for that in a minute. So T4 and T3. T4 and T3, what we talked about earlier, is the increase the metabolic rate of many tissues in the body. So in other words, if you get low on those, we know your body's going to slow down. They allow oxygen to get in the cell and burn, creating energy and heat to fuel the body's functions. The thyroid reduces the energy T4 and T3 to convert calories into heat. It stimulates appetite and digestion. It increases the utilization of carbohydrates and fat from food and protein synthesis. So in other words, these things are very, very important. Now, just to kind of get an idea of what we're talking about microgram dosing of these thyroid hormones. So a lot of times an average dose of T4 might be 100 micrograms. Well, let's look at what a baby aspirin is. 1,000 micrograms equals 1 milligram. So if a baby aspirin, or I call it baby aspirin, but it's really low dose aspirin now, is 81 milligrams, is actually 81,000 micrograms. So as you can tell, that is a very potent chemical. Okay, so we're talking about small amounts of very important chemical that these thyroid hormone, that thyroid gland secretes on a daily basis. Okay, so these are very potent hormones. So how do we convert T4 to T3? Well, it has to be done in the liver. T4 is converted to T3 in the liver. Some of it's done in the GI tract, but most of it's done in the liver. T3, of course, is the active hormone that helps thyroid make its metabolic effects. When the thyroid dysfunction occurs, it is most commonly due to a decrease in the body's conversion of T4 to T3. That's why it's important when we look at T4 and T3 and TSH, if a patient sometimes will have adequate T4 levels, but their T3 levels are really low. Well, that's telling us they're having a problem taking the T4 and converting it to T3. And this is a common problem that we see. So when a doctor only measures a TSH or T4, they're missing some of the picture, because the TSH could be okay, the T4 could be okay, but the T3 might be a problem. And so there's ways we could treat that, and we'll talk about that in a few minutes, but you know, what is causing that issue? So we need to look at what's causing that issue. And again, the body does need both to function properly. We couldn't give you T3 all day long, but we might have to give you 4 or 5 doses a day. That's pretty hard to do. So we like to give T4 and T3 both together, sometimes in combination. Sometimes we give T3 by itself if the T4 is okay. And when we find that people, their levels look okay, but the patient feels really fatigued, we'll call that a functional hypothyroidism. So again, we're thinking that something's going on down at the cell. Something's not working at the cell. Okay, so now we talked about T4 and T3. Let's talk about things that stop the conversion of T4 to T3. And this is where Paul and I kind of like to delve. You know, we like to look at, hey, what's the issue? Can we get away with talking to a patient and trying to help them improve their health without giving them hormones? So again, we look at the T4 and T3 numbers, so we look at the TSH, but nutritional deficiencies are important. So selenium and chromium, vitamin A, B2, B6, B12, and vitamin E, zinc, iodine, and iron are all deficiencies that can affect the way the body takes that T4 to T3. So a lot of times, it's pretty simple. We put people on a multiple vitamin. We just make sure that they have some minerals in there, such as zinc and selenium. And one of the things that doctors will do just to make sure they're not missing something is when people come in and say, I'm fatigued, well, what's one of the other causes that can cause people to fatigue? Being anemic or having low iron. So if they don't have B12, which can be another form of anemia, or they don't have iron, we need to give patients those products too. If they have a liver or kidney disease, so if you think about it, if your liver's not working right, then you might have a problem taking that T4 to T3. Well, how about also if there's things in the liver that can can affect that. Maybe we're doing pesticides or whatnot. So the other thing that is, the body likes to preserve the brain as much as it can. So if you're under chronic stress and your body's making large amounts of cortisol, it'll say, hey, there's too much cortisol coming out, and you're kind of in this increased burn in your body. So it'll slow the conversion to T4 to T3. If you take estrogen, especially in the form of oral estrogens, and we see this in birth control pills, for example, or we used to see it in drugs like Premarin, they will block the conversion of T4 to T3. Gluten sensitivity, obesity. Okay, so obesity, that seems to kind of, I'm getting too much calories because I'm eating too many calories. The body says, well, wait a second, something's not right here. It will block that conversion of T4 to T3. Starvation, the opposite, will also do it. And then heavy metals, because heavy metals can gum up the liver. What kind of medications? We talked about medications. Well, if you think about it, some things, of course, are going through the liver. Well, we talked about estrogen already. Steroids. So, if you're taking prednisone for rheumatoid arthritis, that can affect your thyroid gland. Some of the different antidepressants, the SSRIs, so a drug like Prozac can do it. Patients that are taking painkillers like opioids, that can block the conversion T4 to T3. Beta blockers, another blood pressure medication. Lithium affects your iodine levels. And we already talked about birth control pills. Okay. There we go. Okay, so what happens with cortisol? Well, a study on Thyroid Research 2012 was published, found that there was an increase in thyroid stimulating hormone when they found healthy young men and women that had elevated cortisol. So the conclusion was that there was a definite correlation between TSH and cortisol. And that was a pretty elegant, study that they did. They looked at healthy young men that had normal ranges of cortisol, and they looked at healthy men and women that had large amounts of cortisol. And they found that they found a linear relationship. In other words, the more the cortisol went up, also the more the TSH went up. And again, we talked about TSH being a reflection that the thyroid gland needs to work harder to make more thyroid hormone. Okay, so again, kind of another chart to kind of let you see it, and you don't have to worry about reading all the stuff on the slide. But if you see cortisol and thyroid, they're kind of both doing the same thing. They're affecting metabolism, and they have to be balanced. So if you get too much cortisol, it's going to lower your thyroid. You get too much thyroid, it's going to lower your cortisol. So there is this relationship between the two of them that's very important. Okay, so again, what happens? Stress is an extra demand on the body, and it can be psychological, physical, or biochemical. So in other words, you could be stressed from anxiety, death of family, COVID. Could be physical stress. Marathon runners, for example, people that really over-exercise actually can affect their cortisol levels, not for the good either. Or it could be a biochemical. I'm drinking lead water, or whatever. It's stressing my body. So stress triggers the adrenal hormone cortisol. Cortisol engages in the fight or flight responsive. And over time, cortisol lowers thyroid hormone as a protective measure. So I kind of said that earlier. This is kind of a graphic so you can kind of see it. Well, what else can affect thyroid? Earlier, we talked about blood glucose. So if you have increased insulin, okay, and that means the body is under inflammation. Maybe it's because your body's not utilizing carbohydrates. You're going to see an increased cortisol response. Cortisol levels are going to go up. And then what happens is the body's going to compensate. It's going to decrease the thyroid. So again, some of the things that we talk about is trying to help people get back kind of on a low glycemic diet. We try to get that insulin level to come down. So again, you can measure things like insulin to find out. So I think diabetes is affecting my eyesight. I have trouble seeing the consequences of my poor food choices. Modern living. So we start talking about, chemicals. We have 87,000 chemicals in use today, of which greater than 15,000 chemicals are produced in amounts of 10,000 pounds per year. And the Environmental Working Group found that basically when they looked at umbilical cords of babies, they found that there were 200 chemicals in babies, in 10 babies. So they are with us. They're in our water supply, they're in our food, they're in our air. These things are, we don't know the long-term effects of all this modern living. We don't know the long-term effects of cell phones, et cetera. And of course, I'm not telling you that we need to go live in a bubble or go back to the cave, because that's not possible. But we need to start thinking about strategies. How do we keep our liver healthy? How do we keep the thyroid healthy? How do we start looking at these things at age 30 instead of age 65 when we have overt thyroid disease? Okay. And again, that's just another visualization of what toxins do. And of course, we know that drugs and alcohol, we know that that having bad GI function, where we're getting bacteria in there, affects our liver, that we poor digestion, again, pollutants and heavy metals. Those are things that we all get exposed to. So something else that it gets that we tell patients to think about is an autoimmune diet. Autoimmune diets are for patients that have Hashimoto's. I'm not an expert on autoimmune diets. You can Google and find all kinds of autoimmune diets. So basically, we're looking at trying to get rid of some of the triggers, and we work at digestive health. So, for example, we try to avoid things like soy and gluten and corn and things that people tend to have allergies to. We try to eat a more healthy plant-based diet, a Mediterranean diet per se, maybe. But we're trying to not eat processed foods, because we know all those contaminants and stuff, again, are causing part of that immune system reaction. Okay. Again, this just talks about detoxification. And what I want you to see on there is notice all the different vitamins that are involved in your liver for detoxification. And the goal is, when your liver's job is I kind of liken it to like my garbage disposal. Its job is to get the stuff, ground up and out. Okay. And that's exactly what you're doing. So toxins such as pesticides, et cetera, are very what we call fat soluble. They're out swimming around and they're getting deposited in your fat tissue, which is where they like to go. Your body can't get rid of them. So your liver takes these different chemicals and it has chemical reactions with them, makes them what we call more water soluble. So you can basically urinate them out through your kidneys. That's what your liver does. Well, if you think about it, if you're eating healthy and stuff, you're protecting your liver. But if you're not, you're eating a lot of processed foods, or you are under, pesticides or whatever it might be, your liver is not functioning like it should. So now these toxins start to accumulate up. And I saw, I just talked to an oncologist today, and she said they are seeing a lot of fatty liver disease now. And we predicted that about 5-10 years ago, that we were going to start seeing a lot of fatty liver disease in people that really shouldn't have liver issue. It used to be we thought cirrhosis of the liver, the leading cause was alcohol. Now we're going to see non-alcoholic fatty liver disease, which is the description of that tells you they're not consuming alcohol. Is going to outpace actually liver disease induced by alcohol and drugs. So, keeping our livers healthy really is an important thing for our overall health. Okay, so what can help the T4 to T3 conversion? Well, again, some of these things, as you'll see, we're on that slide that talked about the liver, okay? So selenium, vitamin A, vitamin D, chromium, making sure that you have adequate testosterone. So as we age, for men, especially, our testosterone levels drop, and testosterone plays an important role of helping that T4 convert to T3. Tyrosine is a protein, and I'll talk a little bit more about that when I get to the slide on tyrosine, but that is the building block for thyroid hormone. So actually, iodine plus tyrosine molecules, when you put them together, make your thyroid hormone. So it's important we have iodine in our diet. So like I said, worldwide, low iodine is the #1 cause of thyroid disease. United States, that's not the case because we get plenty of iodine in our diet. We get iodine and iodized salt, and it's also in some foods. And tyrosine is a fairly common protein. However, some patients need more of it. And again, right with that high protein diet can help increase it. So sometimes vegetarians, they don't like to hear me say this, but if they aren't getting enough protein, they are going to have problems making thyroid hormone. So let's talk about how we treat it and support it. So the mainstay for sure for 95% of patients in the country is the drug levothyroxine. The brand name is called Synthroid or T4. And for many patients, it works just fine. And what happens is that T4, you're supplementing the T4 because the gland can't make the T4. And the body takes that T4 and it's got a very long half-life. In fact, the half-life on Synthroid is 7 days, which tells us it takes weeks for that level to get up. So when a doctor puts somebody like on a T4 or Synthroid drug, they're going to tell you to come back and get some blood tests after about 2 months. And the reason for that is that drug has to build up and it has to have an effect. So they're going to measure your T4 levels and they're going to measure your TSH. That is quite common. And they're going to look and see if your T4 levels went up and if your TSH went down. Okay. So if it does, patient feels great and they're good. The drug is widely available. It's, like I said, it's the #1 drug. It comes in about 6 or 7 different strengths, I think now. And it is by far the mainstay. Now, if I was going to take T3, there's only one commercial product of T3 out there. It's called Cytomel. And the problem with it is Cytomel, T3 has a very short half-life, which means the drug doesn't hang around a lot in the body. So you got to dose it 2, 3, probably 4 times a day for some patients, okay? Now, T3 is extremely potent, as we said. So we're going to use small amounts of it. Unfortunately, there are only 2 strengths of it available. So that makes it kind of hard because you got to have the right type of it. Plus, you got to take it a few times a day. So a lot of times patients don't like that drug. And that drug, if you overdose somebody on it, their heart's off to the races. They don't feel very good. And their heart rate goes really fast. Their blood pressure goes up. They get anxious. It's not very pretty. The other thyroid is combination thyroids. And one is Armour Thyroid, T4, T3. Again, it's available in some commercial strengths. This thyroid has animal antibodies in it. A lot of patients actually do pretty good on it. They'll feel pretty good, but a lot of Hashimoto's patients don't do well on it. And one of the reasons that they don't is because their the animal antibodies start attacking the thyroid gland itself. So we'll start seeing why TSH swings. So not everybody does well on Armour Thyroid. Some people do great on Armour Thyroid. So it can be an alternative to T4, T3. The other problem is 2 problems. One is there's variability in lot to lot of the amount of T4 and T3 in it. Also, we predict that most Americans have about a 10-to-1 ratio, or 10-to-1 ratio of T4 to T3. And in the animal thyroid, it's more a 4-to-1. So in other words, the animal thyroid has more T3 in it. So sometimes patients, as we're increasing the dose, their T3 goes up significantly and the T4 doesn't go up. So then we still have problems getting good control. Now, the compounded T4, T3 is purified T4 and T3 that we blend together. And we can make it either as an immediate release or an extended release. And sometimes we like that extended release because we don't like to dose that T3 several times a day. So that's dosed once or twice a day a lot of times. So again, those are the commercial products that are usually used, the prescription drugs, and we specialize in the latter down there. However, we have also made sustained release T3 too. So the vitamin supplements to support are going to be vitamin A, the B vitamins, selenium, tyrosine, and iodine, and then there's some herbs that we're going to talk about. So that's what I'm going to spend the next. How am I doing on time? about 5-10 minutes on, and then I'll open it up for questions. Okay, so vitamin A. If you went and you got a thyroid formulation, product that's recommended for thyroid, you're going to find they're going to have certain vitamins in it, and one of them is vitamin A. And why is that? Well, vitamin A is very important for regulating the production of thyroid hormone, and even more importantly, for helping the pituitary secrete thyroid stimulating hormone. Okay, the pituitary depends a lot on vitamin A. So we also, we're in the COVID days, right? So we're seeing a lot of people take vitamin A. So a couple things you need to remember. There is beta carotene, which is different than vitamin A. Beta carotene is what you're going to see in most of the multiple vitamins. And that has a great antioxidant activity. But vitamin A itself is a vitamin that you can get toxic on. So you have to be careful. You don't want to take too much of it. If you're pregnant, sorry, Kylie, you can't take vitamin A, okay? You have to be very careful because vitamin A is, anybody heard of the drug Accutane? Accutane is a vitamin A derivative, and we do not give it to pregnancy because it will cause an abortion of the fetus. So vitamin A hits in that same category if we give people too much of it. And typically we would say if we gave over 10,000 units, that would be too much for a female. So we have to be careful with it, but you'll see about 5,000 units being put commonly in some of those vitamins, thyroid vitamins. And here's a vitamin A study. 4 months a study in 84 women concluded vitamin A supplementation reduced TSH levels and might reduce the risk of what we call subclinical hypothyroidism. Remember, subclinical is when the TSH is high, however, the free T4 and the free T3 look in range. Now, what's interesting is I've never met somebody in subclinical hypothyroidism that ever felt good. Their TSH is high. They still don't feel good, but they're not treated by the doctor because they say, well, your T4 and your T3 are good, and I don't want to overdose you, okay? However, here's a perfect example of something we could use to maybe help bring that TSH down and help the patient feel better. That's not prescription. Vitamin B. Well, there are a whole family of vitamin Bs. They are very important. Remember when I talked about enzymes? Enzymes need vitamin Bs. They don't work if you don't have them. So enzymes are basic chemicals that our body makes that helps move a reaction forward. So in other words, the reaction might happen, it might take 4 days, but if I give you an enzyme, it takes 5 minutes. So the enzymes are important. They get triggered and they make the reactions go forward. However, they rely on what we call coenzymes, and coenzymes basically are vitamins. So if you are low, for example, in thiamine, you're going to have a problem making thyroid hormones. So again, we usually don't just say, okay, we're going to give you one B vitamin. We usually look for a complex and we give a bunch of them. So again, if you also look, if you were low on B12 folic acid, you're going to have low fatigue anyway. So we're going to make sure you're getting certain vitamins really at a pretty decent level. Vitamin D3. Well, by golly, what does vitamin D3 does? It does everything. And one of the things it does is it helps, again, it helps with those autoimmune conditions. We know that, but it also helps do so much for inflammation as well as bone health, etc. So vitamin D3, we're in Indiana, it's January. Everybody probably should be taking a little bit of vitamin D for sure. Selenium. Okay, selenium is involved in different the different production of thyroid. So selenium is involved in so many different things. So selenium you'll see is almost in all the thyroid vitamins. So one of the things it does is selenium itself makes a enzyme called my brain's going blank here, but it is a conversion enzyme that takes the T4 to T3, and it has to be there. Now, if it also makes a antioxidant called glutathione in your liver. So if you're under a lot of stress from pesticides or toxins, your body will use that selenium up because it has to take care of that first. And then there's not enough selenium to connect your iodine and your tyrosine hormones together, or chemical molecules together to make the thyroid hormone. So selenium is really important. And we basically try to dose somewhere between 100 and 200 micrograms. And you want to take it. Now, this is where you have to be careful. You know, you don't want to take it with the thyroid hormone. You take it actually separately from the thyroid hormone. And the best form of selenium is selenomethionine. That is actually what we call a selenium chelated selenium. And that's actually a protein that wraps the selenium and allows your body to absorb it better. So what's cool about this one is there's studies that show that selenium actually reduces those thyroid antibodies that we don't like to have made for autoimmune. Chromium is another one that plays a role. It activates the thyroid cell receptor. So remember, the way the thyroid T4 and the T3 work, T3 sits on the outside of the cell, and it opens up the door and allows the T3 to take in that iodine is a magnet, and it takes oxygen into the mitochondria of the cell. And so what it's doing is it's helping supply oxygen in the machinery that makes ATP, okay? And ATP is our gasoline. So we have to have that. So it's important that our cell receptor works, and chromium plays the same identical role in diabetes with your insulin receptor. So having good chromium levels is really important. Again, you don't have to have a ton of it, but you do need to have a little bit. And again, a good multiple vitamin usually have some chromium. I have seen for diabetics, they will push that dose sometimes to get the insulin for people that are what they call insulin resistant. But for thyroid disorders, we don't tend to push the chromium that high. Another important caveat is, again, it's a mineral, so we want to make sure we don't take it at the same time as our thyroid hormone. Just like selenium, it needs to be a few hours away. Boop, boop, boop. Wow. Okay. So we talked about tyrosine and iodine earlier. Basically, the tyrosine dose is 500 milligrams to 750 milligrams twice daily. And tyrosine is the building block. You'll find, you'll see some iodine in products like kelp. Again, those tend to be low dose and they're perfectly safe. Sometimes you'll find iodine and tyrosine together in the thyroid vitamins a little bit. And you usually see about 150 milligrams. I finally figured this out. Okay. So again, we talked about iodine being a number one deficiency of low thyroid disease. Too much iodine, though, can be dangerous. Okay, so too much iodine, such as 12.5 milligram, although it's over the counter, it should only be used under a physician's care, in my opinion. We carry a product called Ioderol, and there are some patients that will come in and request it. We carry it behind the counter. And we certainly will sell it if they request it, but we always recommend, we always counsel that they should be under the care of their doctor, because too much thyroid can actually make thyroid disease worse and actually cause a goiter. And most OTC products, if you could see, have about 150 to 300 micrograms of iodine in it. And now we're talking about 12,500 micrograms. So it's a lot higher dose. So again, under doctor's care, I've seen iodine really help patients, but I also have seen it cause some real issues. So we don't typically recommend it unless you've been tested for that. And there are some sophisticated tests that have to be done, such as a 24 urine iodine, or they sometimes will do radioactive iodine and see, what's going on in your urine to see. Okay, zinc and ferritin. Zinc, again, turns some enzymes. So you can see that there's a lot of minerals involved in your thyroid. Activates enzymes that turn T4 into T3. And ferritin helps transport the T3 hormone through the cell where it works on the body. So again, a lot of times we like to measure iron. And if patients' iron levels are low, we'll recommend ferritin. Ferritin is a transport iron, and it kind of helps move the thyroid along. Okay, so here's a couple herbs that are commonly seen. We find these in some of our things. Now, I've got to be honest with you, most of the herbs, the data on them are very scanty. So for example, Google and Bacopa here are used in a lot of products. However, they're in mouse studies. There's no human studies at all on these things. We do know that Bacopa has increased T4 concentrations by 41% in mice. And we know that Google reversed drug-induced hyperthyroidism in mice. However, we're not mice, right? So, you know, we don't know what they do, but you'll see that we have some of those type of vitamins. And again, I typically say they're pretty safe. But if you're on thyroid hormone, I would be very concerned to put somebody on Bacopa, for example, because maybe your doctor already has you regulated, and then we give you something like that, it might cause an increase your T4. So, you know, which make you hyperthyroid. So we have to be careful with those. Well, that went the wrong direction, didn't it? Oh, mercy. Okay, ashwagandha. A small study of 50 patients showed that 600 milligram dose of thyroid of the ashwagandha actually normalized thyroid levels in subclinical hypothyroid patients. Again, those are patients that the T4 and T3 were probably okay already, but the TSH kind of came back down. So at 600 milligrams is a pretty good dose of ashwagandha, to be quite honest. So when we start looking at what's put in some of the thyroid medicines, there's usually about 100 or 200 milligrams in, the thyroid vitamins. You'll see that there's some ashwagandha put in them, but they're a little bit lower. However, we might consider putting somebody on the full strength ashwagandha to see if that would help. And forskolin is another one. So in this, again, this was in dogs. It's not people. In dogs, forskolin injection increased T4 to T3 secretion from the thyroid gland. Okay, so that's really the only studies we've seen. However, you will see that people do take that also. And of course, you know, you can buy all these vitamins together, or you can buy one kind of product that has a lot of those things in them. And so, you know, I tend to look for combination products. Might put somebody on a multiple vitamin. I might put somebody on an ashwagandha if they don't feel like they're improving under a thyroid support type vitamin. But that's basically the easiest way to do it. Also, there is one other therapy that we're using for Hashimoto's now, and this is kind of a nice segue because a week from Thursday, we're actually going to be talking about low-dose naltrexone. And if you're interested in listening, low-dose naltrexone, I will cover its use in thyroid disease and autoimmune disorders. But low-dose naltrexone is a prescription drug that we compound. It blocks these pro-inflammatory cytokines. Everybody's heard about cytokines this year, which shifts our immune system, and it helps regulate autoimmune disorders. And it's proven effective in studies for other autoimmune related diseases such as Crohn's disease. Quite often it's used in Crohn's disease. It is a non-FDA dosage form, low-dose naltrexone, so it's not approved by the FDA. The commercial product is about a 50 milligram dose. And this is, we're talking about 0.5 to 4.5 milligrams. So we're talking about 1/100th to 1/10 that strength. And it has to be prescribed by a physician. So, but we have used this in Hashimoto's patients. We have quite a few patients that actually are getting some pretty positive results on it. And how am I doing on time? Always run out of time. Okay, Kylie, you're up.
Had to get unmuted here.
Yep.
Okay. So this last slide basically just shows that obviously the thyroid support with zinc that Greg recommends. You had said before that the ingredients in this thyroid support with zinc, it wouldn't hurt somebody to try it, correct?
Right. We would look at it and again, kind of make sure the patient's not taking a large amount of thyroid hormone. I believe there is some Bacopa in there.
Yeah.
So I kind of look at that. But for most patients, and you know, I like this for a patient that's coming in, their TSH is kind of starting to get up high, and they're having some blood sugar issues, and they're under a lot of stress. We would use this. product to try to help them. So it's a good product because it has a good mix of the other minerals in it too. So
Right.
we've had patients that have been pretty happy with it.
Yeah, it's a really good seller for us for sure. So this product is going to be on sale. It's on sale now through the end of February as we continue on talking about thyroid the rest of the month, but then transition into our blood glucose. Obviously, we have low-dose naltrexone next week on Thursday. And that's another webinar that if you're interested, you can send me an email and I will send out the link to register. Once again, it works exactly like this. So that's next week. And then you can view the list of upcoming webinars and events all the way through the end of April. So if you have any questions, feel free to send me an email. You all have my email address. It's the same one that I had sent the registration link to. So ask me any questions or sign up for any events that way. Also, we do have a question currently, but I want to open it up to all participants currently that this time will be utilized to answer and go over any questions that anybody may have. The first question that we have currently is, what about magnesium levels for those with hypothyroid?
Yeah, I have not really found anything about magnesium having much of an effect on the thyroid. However, magnesium is involved in 300 different enzymatic reactions. So especially patients that have issues with stress and blood glucose levels, so it may have some insulin resistant, magnesium is very helpful. So it stands to reason that if you 80%, somewhere between 75 and 80% of the population is low on magnesium. Okay. And so, there are many different reasons for that, but part of it is because our bodies have to work harder to metabolize, and magnesium is definitely has a role in blood glucose and cortisol. Great question.
All right. Just give it a couple of moments here. There currently aren't any more questions. But that doesn't mean that there won't be. Let's see.
I'm sorry, my mouse wasn't working very well tonight. I couldn't get the slides.
Yeah, that was kind of weird.
Yeah.
Oh, I do have another question. How do you work with other doctors to determine what should be compounded?
Yeah, great question. So we have, like I said, about half a dozen doctors that just pretty much they send me the thyroid levels. And then what we do is I type up a recommendation and I send it back to the doctor, and then they send me a prescription, or they, modify my recommendation. So typically the biggest problem we have is for us, we don't always have the complete medical record. So we can't always find out all the details. So a doctor they may send me the patient that has the most, they put on Synthroid, for example, and they just can't get them feeling better. So then they'll send it to us, and they might have even tried Armour Thyroid, and then they'll send them to us, and then I'll try to figure out what the T4 and the T3 is, the TSH, and what they're currently on. And then I just kind of start tweaking it and see if I can get people to feel better and try to get their numbers into the ranges we like them at. What I've noticed over the years is as we've worked with porcine thyroid, the Armour Thyroid type drugs, you may push the dosage up and all of a sudden your T3 gets out of range. It gets too high. So that tells me that we need to take the T4 up more aggressively and take the T3 up less aggressively. And we just can't do that with the armor thyroid type porcine thyroids.
Okay. What does BHRT stand for on upcoming webinars? That's,
Oh, good question.
yeah.
So BHRT stands for bioidentical hormone replacement therapy. So that is the natural hormones. And I don't even like the word BHRT, but that's what everybody knows it at. I like natural hormones. I think that's more descriptive. And basically, Paula, why don't you explain what BHRT is?
Well, so bioidentical hormones are the chemical structure of the hormones that we make as humans, not as horses or dogs, but as humans. So as a female, we make 3 estrogens, progesterone, testosterone. And so the bioidenticals are going to be as close to the human structure as possible. And we typically do not see as many side effects as those. And we can titrate the dose according to the patient's needs. So it's not 1 or 2 or 3 different strengths fit everybody. It's what works best for that patient.
Sounds good. Okay, the next question is high cholesterol related to insulin resistance and hypothyroidism?
Oh, great question. So, yes. So,
Great
we
question.
know that, for example, if you're hypothyroid, that can cause your cholesterol levels to go up. And low thyroid and insulin resistance are intimately related. So, it's interesting that when you look at patients that have diabetes, they are at much higher risk than healthy patients to develop thyroid disease. And patients that are low thyroid also develop more diabetes. So it's interesting to me, they're both diseases of metabolism. And when we talk about metabolism, we're talking about burning calories. And we burn calories 3 different ways. We either burn it through fat, carbohydrates, and when we're really starved, we'll burn protein. However, we burn protein last typically. So when we start looking at diseases such as diabetes or thyroid disease, they are going to affect how our body burns or stores calories. And it's going to affect our carbohydrate, our protein, and our cholesterol levels. And cholesterol and blood sugars are the 2 that are usually affected most dramatically. So yes.
Yeah, and usually once you get the thyroid under control and your blood sugars under control, that cholesterol will go down. Your triglycerides will go down.
Right.
Next question. Who are the doctors that work well with you? There aren't very many doctors who seem informed with how to best treat thyroid.
Yeah, that's a great question. Paul, you want to take that one, or it might be best for you to just give us a call and we can.
Yeah, I mean, 'cause we do have some integrative practitioners that we work with. There's a few, family doctors that we work with. So, we can, help you out with that if you want to either email me or call the pharmacy. We can give you, a few of the names that we work with.
Okay. And Paula, do you want to give your email address just so that's easier for them to?
Yeah, so it's just my name, Paula, at fwcustomrx.com.
Okay.
I think, is that on our website, Kylie?
It is, yes. Yep. And also, if any of the participants currently don't remember that, or you're welcome to send me an email as well. Same email address that you received the registration email from, and I'd be happy to send you over to Paula or give you her email address personally. So I don't see any more questions currently. If you do have any more questions, you're welcome to ask them now. Greg, do you have any?
Well, just thank you all for joining us. We're excited. We have quite a few. As you can see, we've kind of planned out the next few months. With COVID, I personally like to do live meetings, to be honest with you, but we know that it's probably up through April, May, June. That's going to be out of the question. So we wanted to get back on to getting more information back out to people and try to explain kind of our philosophy, how we do things. And, you know, Paul and I would continue to learn all the time, learning new things, doing new CE. We were getting ready to embark in a 3-month CE course, our continuing education course. We're going to learn some new things. So we're always happy to, we love to share this information. And again, even, you know, even if you don't buy anything from us, and that's not the point. The point is to be aware of your health and start looking at those labs. And how many times over the years I've seen people, their TSHs have crept up. Nobody did anything about it. And then all of a sudden they got thyroid disease. And I would prefer you to start learning, understanding that, hey, what you eat on sugar can affect your thyroid disease, or you know, try to stop those things now for your own health and improve your own health. So we hope that you join in, tell other people to join in so that other people can learn and we can all learn. We can move through 2021, have a better 2021 than we did last year, get past this COVID and have a better, healthier year. So thanks for joining in tonight. Appreciate it. And feel free to contact the store if you have any questions, either Kylie, Paul, or myself, and we'll certainly get back to you. Kylie's in charge of my Facebook, so if there's any questions you wanted to send through Facebook, that's fine too. So anyway, thank you. And I guess I went a few minutes over, but I got started a little bit late. Sorry about that. Thank you.
All right. Thank you. Bye, guys.
Bye-bye.